Hello, Aaron here. I have PDD, autism, Tourette syndrome, and OCD. Also, I'm mentally disabled and have learning disabilities. I am first grade level at reading, second grade level at math, and I'm mentally first grader age. Also, because of medications I take for my mental disabilities, I have a rapid heartbeat, but I take medications for my rapid heartbeat. Also, I have fears of crowds, loud sounds, and yes, when people ask me over their house, I don't know how to respond, and that's for frustration. Also, it's hard for me to interact with others. Also, autism is kind of like a brain delay that affects social interaction, and autism makes it hard to process what other people are saying. Also, autism makes it hard to process other people hugging and kissing, and autism makes it hard to process other people holding hands. Also, just to let you know, autism makes where people are anxious around large crowds and loud sounds, and autism makes where people are anxious wearing backpacks. Also, autism makes where people are anxious at school all day, and autism makes where people are anxious on the school bus. Also, autism makes where people are anxious when fire alarms go off at school, and autism makes where people are anxious eating lunch at the school cafeteria. Also, just to let you know, autism makes where people have a hard time tying shoes and buttoning shirt collars. Also, just to let you know, the signs of autism are lack of social skills, lack of eye contact, lack of speech, and lack of communication. Also, when people act up in school, that's a sign of autism. Also, just to let you know, when people have low grades in school, that's a sign of autism. Also, just to let you know, when people stim in school, that's a sign of autism. Also, just to let you know that stimming is kind of like hand flapping and hand motion and hand movement and hand fidgeting. And people with autism stim in a school classroom and stim walking out of a school classroom. Please subscribe, rate, and comment.